The member from Kitchener-Waterloo.
Thank you very much. My question is to the Minister of Health. In December, I wrote to you and I asked you to reunite Patricia and Don Dayton, who have been married for 64 years but are faced with forcing to be away from each other because they cannot find accommodations. Don, as you know, lives in a retirement home while Patricia requires long-term care. Over 2 months since I wrote to you, Don and Patricia continue to be forced to live apart. My office and their family have worked with the Waterloo Wellington Lynn to try and find a switch for Pat, but after 2 failed attempts, Don and Pat are still waiting to live together again. Can the minister tell Don today how much longer he is going to have to wait to be reunited with his wife of 64 years?
Thank you. Minister of Health, Long-Term Care.
Well, Mr. Speaker, and we had the opportunity to speak in a general sense about this issue, and for privacy reasons, I can't speak about the specifics of this individual case. But yesterday we had the opportunity, and I think we probably all appreciate the importance of this, to talk about spousal reunification. And that is such an important aspect of how we approach long-term care in this province. It needs to be. I can't imagine the anguish, the anxiety, the frustration, the tears of 2 individuals that have lived their whole lives together being unable to complete that in the last remaining years of their life. It's important, and that's why we introduced legislation. And I can't recall, I hope, I suspect, I think the NDP supported that legislation, which allowed us to actually create a separate category for spousal reunification, where we're now requiring, and I mentioned yesterday that this has just now come into place, this opportunity, where we require every single long-term care home in this province to set aside specific, at least one specific dedicated bed for spousal reunification. I'm happy to talk about it more in the supplementary.
Thank you. Supplementary.
Mr. Speaker, the minister said yesterday that he had introduced spousal reunification regulation. But let me tell him, it has not solved the problem. That regulation was made on December 13th. It came into effect on January 1st. And now, 52 days later, Patricia and Don Dayton are still being forced to live without each other. Every day that Patricia and Don spend apart is another day where they deteriorate. Mr. Speaker, at the end of their lives, they are losing precious time with each other, and this government refuses to step up and fix the problem. Why is this Liberal government doing nothing to actually help Patricia and Don spend the rest of their days together?
Thank you. Minister.
Well, Mr. Speaker, it's always challenging to talk about, on the one hand, a specific case and then having to speak for reasons of privacy in generalities, and that to some extent limits my ability to speak about this individual case. And I hope we can all appreciate the importance of maintaining the privacy of these 2 individuals. But, Mr. Speaker, these changes that we've put into place that indeed came into force January 1st, and because of the operational aspects of it, we've been working with long-term care homes, and now all long-term care homes have implemented this new policy, which is the result of tremendous, I would say exceptional consultation across the long-term care sector, including, most importantly, with patients, caregivers, family members, loved ones, clients, residents of long-term care homes themselves, as well as the long-term care operators, to develop a program which reserves a specific bed, at least one, in every home. If there is not a person on the list for spousal reunification, we will make sure that the next person gets that bed, Mr. Speaker.
Thank you.